Now, 3 in every 5 children in Kenya are breastfed from birth to the age of 5 months against the World Health Organization recommendation of exclusive breastfeeding from birth to the age of 6 months. While many factors may contribute to a mother not being able to exclusively breastfeed for the required duration, efforts are underway to ensure working mothers are able to produce adequate milk to sustain their children, especially after they resume work, as NTV's Bridget Ngana found out at the Nakuru County Teaching Referral Hospital, where health workers are now practicing what they preach to mark this year's World Breastfeeding Week.
At the Mother and Child Clinic inside the Nakuru Teaching and Referral Hospital, mothers cradling their children get their dose of health education with a special focus on breastfeeding and child nutrition.
We can breastfeed until I think 6 good months.
This is one of the busiest and largest public hospitals in the South Rift region, and while health workers may be providing the much-needed care for their clients, they too are mothers. And for a while, healthcare workers who were resuming work from maternity leave had it rough.
We did not have a private room where these mothers could express. They had to express maybe in their cars, in the offices, somewhere there they were not really comfortable.
Sylvia Muhanji, an intern clinical officer, has reported for duty, and she is one of the 50 healthcare workers who are using the new lactation room here at the hospital to continue feeding their children with breast milk exclusively until the children attain the age of 6 months.
Before I come to work, I make sure I've taken a meal and I've drank a lot of water, let's say 1 liter. After reporting at 10 a.m. I normally come to express because my breasts are full. After that, I take tea. Then I go back to work around 12 or 12:30. Then I come back express. Since I've stored my milk, I pack all my milk and take back home to my baby.
Nilienda maternity leave, nikarudi after 3 months. Nimekuwa nikitumia breast pump. Nilikuja nikapata kuna hii facility. Nikakuja nimekuwa nikitumia so far. I've used it for a month. Na imenisaidia sana kwa sababu I don't have to think mtoto kama ako na maziwa, junajua nisha pump enough.
The reason as to why I feel breastfeeding is important, it is because of the benefits that we know. It really helps our children, at least for the IQ of our children. They really grow well, being that it really boosts their immunity. Even if there are infections, at least you may find that they really heal faster.
We also provide pumps, electric pumps. We have 2 at the moment, and a sterilizing station because some of these mothers share the pumps. We also provide entertainment such as Wi-Fi for those people continuing to work for the 2-hour break that they need.
For these mothers, this room has been a saving grace, erasing the stress of failing to produce enough milk for their children and the added cost of having to shuttle between work and home just to breastfeed their babies.
Ilikuwa sasa nikijiuliza hiyo time nasikia maziwa imejaa, ni mimi nitakuwa naenda kwa mtoto ama mtoto atakuwa analetwa kwangu. Na hiyo transport, naona pia hapo kuna transport, ama kama nitatumia supplements nitatumia nini.
Sometimes you find that I really have a lot of breast milk, and because I want to continue breastfeeding, sometimes I go back home. But when it gets tough, you may think otherwise, because you may feel like there is no place whereby you can go, stay alone and express breast milk when relaxed. So I really got a challenge because sometimes you'd find that if I stay long at work, sometimes the breast milk reduces because it's psychological.
According to the 2022 Kenya Demographic Health Survey, 60% of children, meaning 6 in 10 children aged between 0 and 5 months are exclusively breastfed. The World Health Organization recommends that children receive nothing but breast milk for the first 6 months of life, and that complementary foods should be introduced when a child is 6 months to reduce the risk of malnutrition.
Breast milk is the first food, the first drink the baby takes after birth to 6 months. Exclusive breastfeeding is very, very important for these babies as it contains antibodies to strengthen immunity. It has the perfect balance of all the nutrients which will also help the baby. It's very important for a mother to produce this milk because this baby will need this milk for the first 6 months of their life exclusively and a follow-up for up to 2 years.
Lactation rooms have been established also at the Gilgil and Naivasha sub-county hospitals. And for breastfeeding mothers working in flower farms in Naivasha, the Nakuru County Department of Health has established 2 breastfeeding booths that also serve as daycare centers in collaboration with the flower farms. For more than 3 decades now, World Breastfeeding Week has been marked all over the world, and here in Kenya it's not an exception. So between August 1st and 7th, mothers across the country will be sensitized on prioritizing breastfeeding. Breast milk has been recommended as the best defense for children under the age of 5, and more specifically in the first 1,000 days of life. Bridget, Ghana, NTV, Nakuru.